Hello, my name is Yamina Briones and I'm going to talk about COVID-19 and the advancement of digital physical therapist practice and telehealth. The definition says that the task force defined digital physical therapist practice as healthcare service support and information provided remotely via digital communication and devices.
Telehealth. What is it? Many of us are staying at home to stay safe from the coronavirus, which causes COVID-19. Our friends and family are staying home too. That means we can't visit them or have them visit us at home. But we can still visit with them on the phone or by using a computer, tablet, or smartphone. The camera on these devices lets us see each other while we talk and visit, sort of like a video. When we meet using video, we call it a virtual meeting or a video meeting. Healthcare workers like doctors, nurses, and therapists are staying at home to stay safe too. But what if we need to see our healthcare worker? Well, we can also have a virtual meeting or video meeting with that person. It can be over the phone or by using a computer, tablet, or smartphone. A virtual or video meeting with healthcare workers is called telehealth. With telehealth, we can ask our healthcare worker questions, tell them if we feel sick or have pain, ask them about our medicine, get information, or anything we need to stay healthy. Now that you know what telehealth is, you can watch our other videos for tips on scheduling a telehealth appointment, preparing for your telehealth appointment, and participating in your telehealth appointment so that you get what you need to stay healthy. Created by Community Vision AT Lab and OHSU. Generously funded by the With Foundation.
The purpose of digital physical therapist practice is to facilitate the effective delivery of physical therapy service by improving access to care and information and managing healthcare resources. Applications in physical therapy. COVID-19 presents digital practice opportunities for improved access, high quality, and safety in physical therapy service for both service user and provider, when deemed medically necessary. It is recommended that in physical therapies engaging should ensure the following. The digital physical therapist is in the best interest of service users and their care. They are fully consistent and competent in the use of chosen digital mode. Pros and cons. In pros, we have that the advantage of digital practice were differentiated for service users, providers, and society. The common benefit for all stakeholders, including improved access to telehealth physical therapy service by building a strong relationship between service users and provider in order to deliver high quality and safe physical therapist practice via telehealth. So in cons, we have that healthcare providers on the front lines of COVID-19 have identified that some older adults prefer telephone use to digital telecommunication interaction because of a lack of technology, understanding, and training. Issue applying in Ecuador. Well, telemedicine is not something new in this country. Since 2006, when the Ministry of Public Health presented a proposal to develop telemedicine in this country, it has been working and applying at the tools that this form of medical assistance provides progressively. Conclusion: the guiding principles require strong provider-patient relationship, valid and reliable evidence, and the conduct of research to show whether telerehabilitation has greater benefits than potential risk for digital physical therapist practice.
Our facilities that are championing telehealth, them doing 15 to 20% more of their volume through telehealth is helping us keep that facility open. With the coronavirus, the big thing that we noticed was patients were still wanting healthcare accessibility, but didn't quite feel safe. Telehealth became that avenue for us.
When we determined what platform we were going to use for telehealth, within a few days we had an entire write-up.
A mind shift that we had to have with our therapist was, just because the patient doesn't want to come in anymore doesn't mean we've discharged them from their care, right? They're still under your care. So the best way to offer that is give them telehealth.
I think a lot of it has to do with just the buy-in of the therapists. We've really had a lot of therapists just jump on board this telehealth thing.
Once we trained our front office people on what to say, we started seeing our numbers start to climb on a week-by-week basis. We had a lot of patients that stopped coming in. That was the big aspect, was calling all those past patients and saying, hey, we understand why you can't come in, but we now offer telehealth for you to be able to still receive care.
When we started doing our telehealth visits, the first week we were at about 13 visits scheduled. 2.5 weeks later, we're now a little over 200 total visits scheduled around the company.
Ensuring that a telehealth visit goes smoothly is both challenging and easy at the same time. I think a lot of preparation beforehand makes you feel a little bit more confident. Obviously, you can't provide the manual techniques that you do. You have to get really good with your verbal cueing. Sometimes I can get the caregiver or the spouse or the son or daughter to come in and assist in, overpressure with some stretching or things like that.
Depending on your contracts with commercial payers, everybody could be a little bit different. So what our payers are having us do may not necessarily be what another place's payers are having them do.
For the most part, everybody is reimbursing normal CPT codes with that 95 modifier.
Our expectation is, if we're doing it with the patient, we'll be getting the same reimbursement as if they were coming into the facility.
If our state boards allow us to continue practicing it and the payers see the benefits of it, I think it's something that can continue to be utilized moving forward. Really don't be afraid to jump into it. It's kind of a trial and error process. There's a lot of people doing it now. There's a lot of resources out there, so there's people who can help.
I think this is actually a tipping point within the physical therapy profession, meaning that it's not something that's going away.